Good morning, Greg. We are now live for our educational webinar. So this is Miriam Glaze from Athlete Soul. I'm the founder of the organization, a two-time Olympian. I'm here with Dr. Greg Charlop, and today we're going to be talking about medicinal cannabis to manage pain. And I'm really excited about this topic because this is something that a lot of athletes have been asking us to talk about, and I think there is very limited education from athletes on this topic. So super excited to be talking about this. Before we get started with Greg, really quickly, as usual, the event is recorded. It's going to be available on our website afterwards. And also you can ask questions throughout the event. So feel free to do that either in the Q&A box or the chat. I will collect all the questions and then ask them to Greg afterwards when he's finished with his presentation. So yeah, you have a chance to participate. We encourage you to do that. There is no off-limit questions. And with this, we're going to get started, and I'll pass it on to Greg to introduce himself and talk about the topic. Thanks, Greg.
Hi. Thanks for having me, Miriam. I'm Dr. Gregory Charlop, and I'm a athlete health and wellness specialist. I take care of athletes, retired and active, who are interested in telemedicine to improve performance or work with mental health and nutrition and diet and other things. And I'm coming to you now live from, I'm on the road. I'm coming to you live now from deep in Louisiana. And so I'm in this coffee shop deep in Louisiana, and we're able to talk about medical cannabis in the least likely place you would think that you would. And that just shows how accepted cannabis has become these days, because in the past you would never want to even talk about something like this out in public. And here we are, people are going around, and no one's getting bothered by this because there's so much more acceptance of medical cannabis. So today's topic, and there's so much you could talk about with cannabis, but we're going to focus sort of on cannabis and pain for athletes. But I do want to give a little bit of background first to make sure that you have a good understanding of this and you can figure out how to use cannabis in your life or for people you know if you think it makes sense. And so, first of all, I want to start out by saying, when you talk about cannabis or marijuana or pot, whatever you want to call it, that's a plant. And so this plant, like all plants, has lots of things in it. It's not just one thing. And so the cannabis part of it, the marijuana, the medical active components of it, there's a whole bunch of them. So the ones that you hear the most of are THC, right? And that's the one that people smoke and they like to use because they can get high or some euphoria from it. And then there's CBD, which is another component. And that's been getting a lot of attention lately. Anytime you go into Whole Foods or any place really, even the drugstore, the gas station I saw it the other day, you can get these CBD products. And so those are becoming very common. And there's actually hundreds of other more minor components that are in the cannabis or the marijuana plant. And so it's important to know, and this is something I think that's critical to understand if you're looking at using medical cannabis, is you want to think of it in terms of these different component products, not just as the marijuana plant itself. In other words, it's not like you either smoke the plant or you don't. It turns out that you can actually separate all these different components of the plant out. And depending on what medical problem you're trying to treat, depending on what's bothering you, depending on your age, even depending on how you tolerate things, you may use different components or different mixtures of these components to kind of get your desired goal. So it's not, I think the mistake that a lot of people make when they think of medical cannabis is they think, oh, I just roll up a joint and I smoke it and I'm going to get better. And it isn't like that, at least not if you do it properly. If you're doing it properly, you want to be thoughtful about it and get the correct components for whatever it is that's working for you, for whatever it is that you need to treat. And so, and I'm going to get more into this later. Actually, why don't we talk about it now? I know you're interested in hearing what you could use it for and the risks. We're going to talk about what you could use it for. We're going to talk about the risks and alternatives. But I just think this point of understanding how to use it is so critical. And so I lived in Texas. I'm still in Louisiana. I'm driving to Georgia where I'll be moving. But in Texas, you can get medical marijuana if you have a doctor's prescription. And you're not getting the plant. What you're getting are these mixtures of different ratios of CBD and THC. And so depending on the medical problem in Texas, and this is true in a number of other places, you would have to get a prescription, and the prescription would say what ratio of CBD to THC there was in your product, and then you would use it. And so this is usually recommended by a doctor, and it depends on your medical problem. And then what you would do is you would use it for a while, and you'd see if it got better or worse, if you were having side effects, did it affect your sleep, your mood. And then what you would do, in theory at least, is you'd work with your doctor and change the ratios or change the components or maybe add other things. And then you would adjust it so it meets your needs. So for a lot of people that are using medical cannabis, the first time you use it, it may not work. You may have the wrong mixture, you may have the wrong ingredients or the wrong ratios. And so one of the things that's important for people who want to do this is you have to be kind of patient, because you need to tinker around with it, usually working with a medical professional. And I recommend working with someone who knows what they're doing. If you're just going to the guy in the corner, and you're getting some cannabis or some shop and you just grab some, it's really hit or miss. You don't know what's in it, and you don't know if it's going to work. And maybe it doesn't work, but maybe it could have worked if you work with someone who was able to help you balance the ratios and figure out what you need. So I think one of the big points, and maybe the biggest point I want you to get out of this, is that don't think of cannabis as just this flower you smoke, but think of it as the components within it, just like with any other drug. Every drug, they're broken down into specific things, and the same is true for cannabis. All right, so let's talk a little bit about the use of cannabis for pain. So first of all, when people talk about cannabis for pain, I would only encourage you to use it for chronic pain. Chronic pain means it's pain that's been going on for some time. In other words, you don't want to use it, or at least I wouldn't recommend it, for acute pain. So you go and you were just injured right now, maybe you stubbed your toe or something bad happened, you've never had this problem before. I don't think your first move should be to use cannabis to treat that. But I don't recommend that. However, if you have chronic pain, and by chronic, I mean it's long-standing, you've been having it for a while, most likely you have a diagnosis, then cannabis for certain pain conditions, many people find to be very effective. So what are these conditions that you may want to try cannabis for? Well, one of them is headaches. So lots of different types of headaches. Cannabis seems to have beneficial effects for both migraine headaches and non-migraine headaches. Some people with concussions, and this is something you'd want to speak to your neurologist about first, but if you have concussions, and a lot of athletes do, some people find benefits with cannabis. Again, speak to your neurologist before. Actually, speak to your doctor before any of this. So I'm not giving you medical advice. This is just for educational purposes. Another thing are cancer pain. So there's been a fair bit of research for cancer pain and cannabis, and a lot of people with cancer have used it. And people with cancer are probably great candidates for it because they have real pain. It's long-standing, it's chronic, and it's much better to use cannabis than the alternatives in many cases. I'll get to those alternatives in a minute. So if you know someone suffering from many types of cancer pain, cannabis is a good option for many people. It's also good for spasticity when you have really tight joints or for joint problems. It's even good for some muscle problems, and it's good for something called neuropathic pain. So some people have neuropathic pain. Some athletes have this. Say you were running and you broke a bone, or you were playing football or something and you broke a bone. Many people will end up getting chronic pain where the break was or further down, like in your foot or something, which wasn't even broken. Those types of pain are often pretty responsive to cannabis. Now, I want to take a step back and talk about the research into cannabis and pain. Now, here's the truth. You're going to hear a lot of people, and they're going to talk about cannabis. Some people are going to be like, yeah, it's the greatest thing ever. You should definitely use it. And other people are going to be like, oh, no, don't do it. It's a waste of time, or it's dangerous, or it doesn't work. The truth is that there just isn't a lot of research, good research on cannabis in humans. There isn't. And this is something that we have really been struggling with. And the reason for that is that cannabis in the United States and in many other countries is the Schedule I drug. What that means is, according to the federal government, there's no medical use for cannabis at all. And as a result, it's like heroin from the federal government's perspective. So as a result, not only is it illegal federally, but also it's very, very difficult to do research on it. These federal government rules make it very difficult to research cannabis. And so we have much less research on cannabis than we would on many other things. And it's a shame, and it's tragic, really, because it has so much potential. I'm editorializing here, but it has so much potential, and so many people swear by its benefits. And limited studies have shown it to be very helpful. But we just don't have the kind of research we should have because of this federal government restriction. And I would encourage everyone, and some of you athletes out there, you have an audience. This would be something I would say to push for if you're comfortable with it. At the very least, we want to find a way of making it easier to research this stuff, because there are so many people who have cancer or other chronic problems that may benefit from cannabis, and there just isn't enough research. Okay, so those are the pain uses you might use cannabis for. We talked about a number of them: neuropathic, cancer, headache, joint, bone problems, things like that. Now, there are also some other non-medical reasons that non-pain related reasons that you may use cannabis for. A lot of people feel that it helps with anxiety. People oftentimes feel that it helps improve focus and reduce distractions for many people. Certainly, a lot of people feel it helps them relax. It may have some anti-cancer properties, which is interesting and really needs to be explored, because there's some pretty exciting data on this. It may reduce your risk of getting diabetes. And then we know that for people that aren't eating enough, people with anorexia, usually due to medical problem, cannabis helps with that. And cannabis actually helps with nausea and vomiting. And so it's a great option for many people for a variety of things. Now, you may say, Dr. Greg, maybe I've got this chronic pain problem, but why would I use cannabis when there's other treatment options? So I want to go into, and by training, I'm an anesthesiologist, so I'm all about talking about pain. I want to go into the other options and show you why, compared to most of them, cannabis may be a better choice for chronic pain. So the two other common ways of treating pain are NSAIDs, non-steroidal anti-inflammatory drugs, and opioids or narcotics. Let's take a quick look at these and why cannabis may be a better option. So NSAIDs are things like ibuprofen, aspirin, Advil, Aleve, those types of things, naproxen. If you're an athlete, you've almost certainly been using these drugs. They're one of the most prescribed drugs. They're heavily researched, heavily used. For short-term use, they're phenomenal. If you have a headache and it's bothering you, and you take some ibuprofen, it will work well. If you have some pain from whatever reason, they're great drugs. The trouble is, when you use those drugs chronically, it can lead to some serious health problems. And so those drugs, the chronic use of these NSAIDs, like ibuprofen, they could lead to, some people think it leads to increased risk of stroke. It definitely leads to an increased risk of gastrointestinal bleeding, bleeding from your stomach or your intestines. Sometimes it can be life-threatening. And it also has terrible effects on the kidneys. So if you have a choice of using NSAIDs long term, and a lot of people use these NSAIDs, ibuprofen, things like that, naproxen long term, they suffer from very serious side effects. And it's actually one of the leading causes of injury for medical treatment are long-term use of NSAIDs like ibuprofen. They have very serious consequences. And so if you have to use it short-term, go for it. You have a bottle, I have a bottle at home, use it when you need, but don't use it all the time without speaking to your doctor carefully, because it really can have very serious effects, especially on older people or people that have pre-existing problems like existing kidney problems, for example. The next very common thing that people use are opioids or narcotics. Again, for many types of pain, these are very, very effective. So these are things like oxycodone, OxyContin, Vicodin, Percocet. Those are all different narcotics. They work great for many types of pain. The trouble with them is that they're addictive. So if you use them for a little while, many people get addicted to them, which is not something you want. Meaning it's hard to give up. You think about it all the time, you crave it. You could also get dependent on it, meaning if you use it for a while and you stop these narcotics, these opioids, you can get terrible withdrawal symptoms, vomiting, you feel awful, it just ruins you. Of course, if you're an athlete, you have to be real careful about this because many of them are banned substances. So you have to be real thoughtful if you're going to use these. There has to be a good reason, and it may affect your ability to compete. They can make you sleepy. They're more likely to get you in a car accident, and they may increase your risk of cancer, oddly enough. So there's all kinds, and they also affect your breathing, and people can die suddenly from these if you have other medical problems like sleep apnea. So opioids or narcotics, while they can be very good, they're very effective for most types of pain, they have very serious side effects. Now, that's why if you're comparing for chronic pain, cannabis to either NSAIDs like ibuprofen or opioids like Percocet, it probably is safer and healthier to use the cannabis because you don't have to worry about all the terrible side effects of the NSAIDs or the opioids, again, for chronic pain. Now, just for the sake of completeness, I do want to talk about some other types of pain treatment just briefly that you should be aware of that work for many people. And so these are things for many people, mindfulness treatments work. Gratitude can work for some people, the intentional practice of gratitude. There are some psychological interventions like cognitive behavioral therapy, things like that, that can be effective for some people with pain that helps you look at the pain differently, interpret the pain differently. Meditation can help some people with pain. Physical therapy for certain people, especially if you work with a physical therapist who's an expert in this, can really help certain types of pain. Omega-3 fats, interestingly, they're anti-inflammatory and they may be beneficial for certain types of pain, like fish oil. So high-dose fish oil may have some benefit. And then also for certain types of pain, like neuropathic pain, antidepressants like Zoloft or Paxil can help. So there are a lot of different things you could do for pain, and it's worth thinking about, speaking to people, even ketamine. There's some pretty far out things. TMS is another thing where they have these devices. Maybe you've seen this. I'm a big fan of these too, by the way. And what you do is you put these electrodes on, you can get on Amazon, and they kind of zap you. And for many people, it actually helps with the pain. But compared to NSAIDs and opioids, I would say you want to go with cannabis for most people. All right, so let's talk about some of the side effects. What are the risks of cannabis? I knocked some of the other treatments, so I'll tell you out of fairness, the risks of cannabis. So one of them, and I'm going to get to this in more detail in a minute, is it may cause you, if you're an athlete, to get kicked out of your events. Right? And we saw this happen with tragic result here in the Olympics. I'm going to get back to that in a minute. But other cannabis-related things you want to worry about is, for some people, it does affect motivation, and it could decrease your drive, which if you're an athlete is not something you want. It can, for some people, it helps your sleep, but other people, it hurts your sleep. So this is one of those things you have to figure out for you. Some people can get dependent on it. It's not real addiction, but some people that use cannabis chronically all the time, forgive the pun there, but if you use cannabis chronically, you can have this sort of withdrawal things where if you stop it, you start feeling sick. It can impair driving. And so you shouldn't use it before driving or operating a heavy machinery. It can affect memory. So some people who are chronic cannabis users suffer from memory loss, which is a big problem. It shouldn't be used by children, by pregnant women, by women who are breastfeeding mothers, because this could affect the fetus, and we don't have a good understanding of it yet. So I don't recommend pregnant women or breastfeeding mothers use it. And people who are elderly should be very careful with it because of the increased risk of falls and memory problems and driving. So I recommend that cannabis be used with caution, extreme caution in the elderly. Now, I want to get back to the issue of cannabis and sports. So here's the deal. Many sporting authorities, and this was a big deal, this came up in the Olympics, right? Many sporting authorities, including the Olympic Committee, ban the use of THC. And so typically when you say that cannabis is banned, and you have to check your own sporting authority, don't go by what I'm telling you, you have to do your own research here. But most sporting authorities, what they do is they ban THC. So for most of them, the other components like CBD, for example, are not banned. And there's a whole bunch of other minor cannabis ingredients I told you about earlier, and most of those are not banned. Most of them are not psychoactive. They don't affect you, they don't cause euphoria or anything like that, just like CBD doesn't. So in theory, most athletes could use CBD or even some of these sort of more minor cannabis components without getting in trouble with your sporting authority. But here's the problem. You may think that you're getting CBD, but your CBD may be laced with THC. You may be thinking you're getting anything you want, some other minor cannabis component, but that may be laced with THC. And so what'll happen is you will unintentionally set off a drug test, and you may get yourself in trouble with your sporting authority. So therefore, if you're going to use cannabis, you want to make sure that it comes from a reputable dealer. So for example, in Texas, these are all licensed places. Many states, they're carefully licensed. You want to look into this. And you want to insist on something called a COA. I would write that down if you're interested in this. COA. COA stands for a Certificate of Analysis. And what that is what they do is that the people that have made that particular cannabis, what they do is they take that, they send it to a lab, a certified lab, and they analyze it. And they can tell you exactly what's in that cannabis. And they'll say that it's got this much CBD, this much THC, this much THCA, whatever. It'll tell you how much is in there. If you get a good one, it'll even tell you things like if it's got pesticides and stuff in it. If you get one, if you're going to be if you're a competitive athlete and you're going to use cannabis, and THC is not allowed, but the other things are, insist on getting the certificate of analysis, because you don't want to be using something, you think it's CBD, you're trying to follow the rules, you're doing everything right, but then you set off that drug test. That's what you don't want to do. So if you get a certificate of analysis and you get it from a reputable place, then in theory, it should be pure and not have the THC in it. Now, I want to talk a little bit about, very briefly, I want to talk about how you kind of use it. Now, I think you probably got the impression that you want to work with someone who's an expert in this. I work with many people with cannabis, and so, you know, I'm a little biased here, but you want to work with someone who's an expert in the use of cannabis. And that's because you want to kind of figure out, as I mentioned before, ratio and what components and everything to use. And it's a lot of trial and error, and you start with something, maybe it doesn't work, and you change it, and it starts working, or it works, but you have side effects, and you change it, and you want to try to get rid of the side effects. So it's kind of a process that takes patience, it takes some experience, and you want to kind of know, work with someone who knows what they're doing. There are some different groups that talk about dosing for cannabis. Again, I'm just mentioning this for informational purposes. I'm not giving you medical advice, and you have to look at what works for your situation. But if you're not a competitive athlete and THC is okay, for many conditions, and again, this is a gross generalization, but for many pain conditions, you might start with something like 5 milligrams of CBD twice a day, and then see how that works. And then if it works, well, you you could leave it alone. If it doesn't work, if you're getting some benefit, but it's not working well enough, then you can increase it. And if you're really getting very little benefit, then you could add THC to it. And so you'd use a mixture of some CBD and some THC. And so I'm just going to read you, this is just one sample protocol. Again, it may not apply to you, but it says the majority of patients can go with this routine scale. That means that you start with 5 milligrams of CBD twice daily, and THC should only be introduced if the patient does not respond to at least 40 milligrams of CBD daily. So once you're up to 40 milligrams of CBD, you might add THC. Again, this is just a general guideline. If you do that, you'd use around 2.5 milligrams of THC, and then you can go up on the THC if you need to, up to around 40 milligrams a day of THC. And for frail and elderly patients or people with chronic medical problems, you have to be very careful. And you probably want to start the THC at around 1 milligram a day, which is much less. And then you can increase it slowly if you need to. And then people that are suffering from severe pain or those who have significant prior cannabis use, so people that are sort of experts with cannabis or really have terrible pain like cancer pain, they can use them. You can start at higher doses and increase more rapidly. So for people like that, they may start with THC. And so you might use, they look at these ratios. So you might start 2.5 to 5 milligrams each of CBD and THC. Anyways, it's a lot of numbers. It depends on everybody. But the point is, you need someone who's kind of experienced with this if you want to do it right. And don't give up if it doesn't do what you want at first, or if you have side effects, don't give up right away. So that's what I wanted to present, and I'm open for questions. If anybody has some questions about the use of cannabis for athletes or for pain.
Greg, that was super, super informative. Really loved it. And you explained a lot of things that I've written down with questions. So I love that. And I like that you talked about how ways to verify the quality of the product. I think this is something we talked about maybe 20 years ago when supplements started to go big with athletes. And there were some supplements where you couldn't verify what was in it. And I feel it's the same process with cannabis now. The message that we get from you is really, you need to work with a professional. You need to have the right quality product. How do we go about finding someone, a physician who is experienced in working with cannabis and can work with athletes? Obviously, they can start with you, but is there a way for athletes to go about this?
Yes, absolutely. So I'll tell you one thing, and this is sort of a painful thing about medicine, but doctors are licensed in certain states. And so this is true for me and for every physician. You can only practice in the states you're licensed in. So I'm licensed in Texas and California and soon Georgia, but if you live in, say, Illinois, I couldn't be your physician. So depending on the state you live in, you need to find a doctor that's licensed in your state. Now, there are some websites that if you just Google, say, cannabis, so say you live in Illinois, if you just Google cannabis doctors Illinois, usually you'll find Google ads for doctors that work with cannabis. And there are some sites, one of them is called Leafly, Leafly. And they're these sort of big national sites, but within them you could search for doctors. And there's another one, I think it's called Medical Cannabis Doctors, I can't recall. But there's a few sort of sites, they'll pop up on Google searches, and they'll have a list of doctors in your state that you could work with. If you're an active athlete, I would strongly encourage you to find a doctor that's experienced in working with athletes, because your issues are going to be a little bit different than a non-athlete, especially because if you're concerned about it affecting both, you don't want to get off a drug test. But the other thing is cannabis probably impairs athletic performance. I didn't mention that, but there was this whole thing with the Olympics and the rationale for banning it, the Olympics didn't even make sense because they say it's a performance enhancing drug, but it's not. Cannabis, for almost everybody, if anything, is probably a performance harming drug. So if you're an active athlete and you need to use it for whatever reason, it's not going to help your performance.
So, and that's a really good segue into what I wanted to ask, because we talked about pain management. I wanted to ask what other uses we have for cannabis. Could it be used, for example, for injury recovery? So this would be really beneficial for athletes, someone who's had a serious injury, they want to use cannabis for their recovery, but it's not necessarily something they want to use ongoing. Would that be beneficial?
Yes, I think if done right, I would say absolutely. And so here's what you would do. The key to if it's a physical injury like you're talking about, usually the key to it, of course, is time and physical therapy. And so if you're an athlete or anyone, if you have even an older person, you're an 80-year-old person and you broke your hip, the way you're going to get back into things is by physical therapy and getting back on your feet. And so if you're having a lot of pain, it may be hard to do the physical therapy. It hurts to do it, or you don't feel like getting out because it hurts too much. So in that case, treating pain allows you to do the physical therapy, which is the thing that's going to get you back out there. So if you've had a big injury, you're an athlete, you're not competitive right now because you're hurt, and it's a big injury. I'm not talking about a little thing. And you're having trouble doing the physical therapy or getting back, on the ground, I would say that cannabis is something you should consider doing in addition to the physical therapy. The other nice thing about it is it's anti-inflammatory. And so the anti-inflammatory effects of it might actually directly help some things like certain fractures in bones and things heal. This is theoretical. This is not proven. But the anti-inflammatory effect is good. Now, the other thing, there are a lot of other benefits of cannabis for some people. We know for sure, like I said, it's great if you have some issue with eating, you're not eating enough. Some people, one of the ways we first discovered this are people with cancer or with AIDS. They were losing weight. And so cannabis will help you improve your appetite, eat more, and it will help with nausea for most people, if that's a problem. It helps for seizures for certain people. And there's a lot of other theoretical benefits, but I do think athletes who've had big injuries could use it in addition to physical therapy.
Could it be something used in the case of stress management as well?
So cannabis is really good for a lot of people with reducing anxiety, and that's pretty clear. Most people feel that way. Obviously, everybody's different. Some people might get anxious using it, but most people get less anxious. And so if you're an athlete and you have trouble winding down, I do think if you're thoughtful about it, you can use things like CBD. I wouldn't use THC for this purpose, but you could use CBD in low doses in addition to like a relaxing routine, whatever works for you, whether it's a light hike or calming music or a bath or something like that, reading a book. So I think it can be helpful. As a general rule, I'm not a big fan of using medications for things that you could do naturally. So I wouldn't jump to this as a first line thing. You're better off, reading a book in the bathtub with calming music. But if that isn't cutting it for you, I think adding something like CBD may be a good option.
I really liked that comment, because I think you are placing the CBD similarly to some other drugs as an active component. If you can solve things naturally with better wellness, better daily habits, it's the first steps, and then consider some other ways to remedy to your issues. I do have a question more on the longevity of the cannabis, and that relates to those who are scared of testing positive or the consequences of cannabis as an athlete. How long does it stay in urine and blood? This is also something that I guess athletes who are recovering for an injury could manage and then go back cannabis-free as they prepare for their season.
Good question. And so the answer to that kind of depends somewhat on the person and how much and how long you've used it. Because what will happen is if you use it for a long time, it'll kind of get absorbed into your body fat. It kind of sticks around for a long time. And it depends on the sensitivity of the test. For most people, if you stop a month or so before a test, that would probably be enough time. But it really depends on like I said, how much you've used and how sensitive the test is. But I think a good rule of thumb is around a month is probably good enough for most people. If you're a competitive athlete, and something really important is coming up, I wouldn't cut corners on that, because you don't want to kind of push it and then not get into your event because you tested positive. The other thing that you may want to do is, depending on how much time you have, is you could always test yourself. You could go to tests and find out if you're testing positive based on the type of test that you're going to have for your event as an experiment to see whether you're still positive or not. But, you just hate to say it, and it's just so tragic with the Olympics now, of putting in so much effort and then getting disqualified for something as stupid as this.
Yeah. And again, same comment as we've done in the past with the supplement, where you either have the supplement tested yourself to see exactly what's in it, so you can trust that brand, or test yourself to know what's in your body too. So it seems that the same rules of caution apply on the cannabis. Another funny question regarding edibles. We hear a lot of people talk about edibles or cooking with cannabis. So can you enlighten us a little bit on what part of the cannabis component is in the edibles? Is it safe for athletes? Does it have any value? What's the purpose of eating edibles?
So edibles. So there's different ways of getting cannabis into your body, right? So eating it, which is what you're talking about, edibles is one way. You can smoke it, which would be like a joint or a bong. You can vape it, and you could even get it sublingually. Like there's these things, like you could either have a lollipop, or there's some ways of mixing it with oil or alcohol, and you absorb it through your mouth. There's even some cannabis creams and lotions, although those aren't very effective. But there's a lot of ways of getting it into your body. So for many people, and I think for athletes, edibles may be one of the better ways to do it. And the reason I say that is, if you're a competitive elite athlete, you may not want to be smoking stuff. There's pretty good data that inhaling pot smoke is not as harmful to your lungs as inhaling cigarette smoke. So from a lung standpoint, you're better off smoking pot than you are smoking cigarettes. And interestingly, it doesn't seem that smoking pot, oddly enough, causes lung cancer, which you would think it would, whereas obviously smoking cigarettes does. But if I were, and I'm not, but if I were an elite competitive athlete, I wouldn't be smoking anything, because I wouldn't want to take the risk of causing any kind of lung problem, even if it's small. For the regular run-of-the-mill, accountant, 40-year-old accountant, who cares, right? But if you're a sprinter or something and your lung function makes or breaks your ability to get into an event, I would not encourage smoking, maybe vaping or edibles. So I think for athletes, edibles are a good option. Now, in general, the way edibles work, and this is important, is they take longer to take effect. This is one reason people don't like edibles. So if you eat, say, a pot brownie, for example, and anyone who's done this knows, you don't feel the effects right away. And so that could be tricky, because then what happens is you don't know, did you eat enough? Did you eat too much? It's hard to know. And then you can get antsy. You have one, you don't think it did anything. You wait 10 minutes, you have another one. Maybe the first one was a fun one. And now all of a sudden you're hit with a ton of bricks because now you've eaten too much. So I think edibles are better, but you have to be careful because of this sort of dosing, which is why you'd want to start low, give yourself time, give yourself some days to experiment or work with someone who's experienced. And that way you can be clever about dosing the edibles properly. The other thing with edibles is they tend to last longer. The effects tend to last longer. So if you smoke a joint, for example, you usually feel the effect right away, and it doesn't necessarily last too long. If you eat an edible, it takes longer to feel the effect, but then it tends to last longer. And so this is important because say it's late at night and you're having edibles, it's conceivable that you could still have some effect of it the next day if you have to have a job interview the next morning, or if you're driving early the next morning, the effect of it may still be on you, and it may impair you at the interview or while you're driving. Whereas if you smoke the joint in the evening, the immediate effects will be gone. You'll still test positive on a drug test, but you should be able to drive safely at that. Now, you can actually get most of the different cannabis components in an edible. Normally, when people get an edible from somewhere, they're kind of getting the whole plant, like a whole dried plant cooked in brownies or something. And so you're getting all of it. But it is possible, depending on the dispensary and the state you're in, to get certain things in the edible where you're just getting some components and not others.
That was my follow-up question: is can you do all of the can you get all of the components in different forms? Can you also get CBD in the form of a pill, just like you would do for other drugs as well?
I feel that the answer to that should be yes, but I can't say that I've seen that. So you can get THC in the form of a pill that's prescribed. And that's available actually for a certain rare seizure condition. I don't believe the CBD is in the form of a pill that you can get from a pharmaceutical company, like Bristol Myers or Bayer or something. I don't think makes a CBD pill. I do think though I'm pretty sure you can get a CBD pill maybe whipped up at some dispensaries. So I think that the answer is probably yes, but it wouldn't be from like Merck or something.
Mm-hmm. Another question is, do you have any knowledge of helping with period pain or period cramps with medicinal cannabis?
Yeah, so I haven't used it for that purpose. I think the answer is it will help with that. I would bet anything that it would. So I think most likely the answer is it would be beneficial to that. The question is whether you should use it for that or not. So if, because your periods, you'd have to be thoughtful about this, right? I think the answer is yes, it would be helpful. But, period pain, it lasts for a few days and then it's gone and you have it again a month from now. So if you're using it for that purpose, basically you're committing yourself to using it several days a month, forever. And so I think you could. If you're a professional athlete, I would probably not do that. Because then you're really using cannabis long term. And if you're a professional female athlete, I just think you're going to run into too much risk probably with drug tests and that type of thing. If you're not a professional athlete, I think that would be fine to do. Oh, there's a train going by. I'm in this place called the Railroad Coffee Shop, and I think it's named because it's right by this train station in Louisiana. All the trains go from, I think, the port of New Orleans probably into Texas or something.
So it's really interesting regarding the period pains. I think a lot of athletes are trying to find alternative ways to cope with menstrual pain, and some of them have taken the pill for a while, but it's not a natural way. It's not necessarily something they want to do ongoing. So I was just curious if cannabis had could be a more natural, more alternative.
Yeah, I think it would. It's one of those things, if you're with someone you trust, I would try it. The standard sort of treatment for that works pretty well are NSAIDs, the things I told you not to use, like ibuprofen and stuff like that. My guess is if you're a healthy, 26-year-old woman and use ibuprofen for say 3 or 4 days a month for your period pain, you're probably going to be fine. I don't think it's going to affect you because you're young, you're in good shape already. And even though you're using it monthly, you're only using it for 3 or 4 days at a time. So I think if you were my daughter and you told me about this, my first recommendation would be something like ibuprofen or naproxen. But if those things don't work, I think, or if you can't use it for some reason, I do think it's, I think cannabis would be worth trying. With the caveat, you would definitely want to get that COA, the certificate of analysis, and know what you're putting in your body.
That makes sense. A question that may be a little bit out of your expertise. I'm an athlete. I want to use cannabis for my injury recovery, for example, or maybe to help with my stress management. Can I travel with my CBD in my bag across the country? Is that going to be a problem?
If it's pure CBD, then in theory, you can travel with that across the country. THC, obviously, you cannot. And so, as you know, marijuana is illegal federally. So what's happening when you get it in these states, like say you're getting it in California, for example, you live in California, say you're getting it in California, it would be illegal for you to transport that across state lines. And I would be very nervous if I had anything with THC in it, transporting it across state lines. I wouldn't do it. That I think is too risky. Or bringing it on an airplane. Even shipping it. Most dispensaries will only ship within their own state. It would be unusual to get something from an out-of-state dispensary. That's something that I think it's just too risky. Interstate transport of illegal federal drugs, I wouldn't do that. Now, if it's pure CBD, then I'm pretty sure the answer is yes, you can transport that, because CBD is not psychoactive. And CBD, if it's pure CBD, is not illegal, which is why you can get it at the gas station and stuff. So I'm 99% sure that you could transport CBD across state lines, but I for sure, even if you get it legally in your state, would not transport anything with THC across state lines, or you're running big risk.
Absolutely. And obviously, you know, the drug test is one big risk, but the breaking the law is a much bigger one. So being very cautious with that, obviously. You have answered all of the questions that I had. I don't know if, Nikita, if you have any additional questions you want to ask to Dr. Gray.
We're putting you on the spot.
We are. But listen, this was a really informative, and what I retain from this is, you know, use caution, work with a professional, make sure you know where you're getting your product from, and verify the quality of your product. It seems that this would be, you know, the most basic recommendation that you
yes.
give.
Yeah, I agree. But one thing I would add to that also, I agree with that. I love what you're saying about the supplements, by the way, because you're right. That's an excellent analogy, because it's the same thing. You know, you use these supplements, you think they're okay, and the next thing you know, you're kicked out of your tournament because it had something in there you didn't expect. But one thing I would add to that is if you try it and either it doesn't work as well as you hope, or it has side effects, don't just give up, because you could tinker with it. You know, by adjusting the dose, or adjusting the ratio of the compounds, or adjusting how you take it. There's ways you can sort of fool around with it and maybe either make it work or get rid of the side effects. So I wouldn't use it once, it doesn't work, and just pack up and call it a day. I think there's ways of making it work or getting rid of the side effects for many people. Obviously not everyone, but many people. So don't give up if you try it, you're not happy on day one.
Okay, great advice. And Nikita did have a question. She's saying, are there any CBD products you know that are designed for athletes?
I don't know any, and I never recommend specific brands, except for fish oil. I recommend Nordic Naturals. But for CBD, I don't. But I think if I were getting a CBD and I were an athlete, I would just make sure it has that certificate of the COA, the certificate of analysis. So if I were a professional, if I were a competitive athlete and I wanted to use CBD, I wouldn't get it, you know, at the gas station, for example. I would get it actually from the dispensary where the certificate of analysis was in the package, and I could actually read it. You know, those things at the gas station, you know, you really have no idea what you're getting. Even at CVS or something, I wouldn't get it there. I get it specifically from a dispensary with the COA.
I think the only space where I've seen a more professional use of CBD, I think, is in the football and NFL space. I did see chefs that specialized in cooking for professional athletes and using CBD. So that would be an area where I think the NFL is a little, well, or at least the athletes within the NFL a little bit more advanced. But I haven't seen any specific brands that have popped up yet in that field.
Let's talk. Maybe we could set something up.
Another question is ingesting more effective than topical CBD ointment?
Probably for most things, yes. The topical ones, they don't have great absorption. So if you're using, there's actually certain skin conditions that people think cannabis may be beneficial for. So for some people, psoriasis may improve with cannabis. And this is very experimental. This may be proven wrong. But for some skin cancers, cannabis may be helpful. So for these types of things, I would use a topical because it doesn't affect the rest of your body and you're putting it right where you want it to do its job. But if you're using it for something systemic, for example, you're using it for sleep or for anxiety or something like that, I don't think I would use the cream or topical. And the reason I say that is it has low absorption. So you're only absorbing a small fraction of it. And to use enough of it that you're absorbing enough of it, you're going to spend a lot of money because, this stuff's not cheap and you're going to have to use probably several times as much milligrams of CBD topically as you would, say, orally or if you inhaled it. So I don't recommend it. I don't think it has any benefit unless you're using it for specifically for a topical condition.
Do you know of clinical psychologists who are working with CBD as an alternative to other drugs?
There are some psychiatrists who do, and so it's interesting. And this is the stuff I wish we had more research for, because there's some evidence that cannabis helps with depression. And there's some evidence that cannabis can help with schizophrenia. But there's also some evidence that cannabis causes depression, and there's some evidence that cannabis causes schizophrenia. So we just don't know enough about that at this moment. If you came to me and you said, I have depression, I want to use cannabis, we have to really sit down and talk about that. Because that's really specialized. So, and I would only work with someone who really focuses on that because that's really specialized and there's risk the cannabis for that can make it worse. For anxiety, for most people, it helps. So there probably are some psychologists. I know there are some psychiatrists who work with that, but the best people to work with for that are people that work regularly with cannabis. There are some, there are a number of cannabis doctors. Many of them are in family medicine or other things, and they can help you. But if you have schizophrenia or depression, some real specific mental health issues, you absolutely want to work with an expert who does that specifically, because it might help you or it may hurt you.
Right. Is there a time frame you should be ingesting CBD before a training? So for example, how many hours before your next training session?
Well, so CBD probably also hurts athletic performance, most likely. So if you're taking it orally, I guess it depends on what you're taking it for. If you're taking it for pain, I would try to take it as far away from your training session as possible. If it's like a real training session, like you're training for an event. If you're training, if you're using it because you're trying to do physical therapy after injury recovery, and you want to help with your physical therapy, in that case, your goal is not to perform at peak level. In that case, your goal is to just be able to do the exercises without having a lot of pain. If that's the reason you're using it, then I would recommend using it about an hour and a half before the physical therapy.
And I'm guessing that this is a drug that isn't reimbursed yet when it's prescribed by doctors. Am I right?
Right. So with cannabis, you're on your own. Even if you get a doctor's prescription, insurance doesn't cover it. And that's one of the reasons you'll look at cost. And, unfortunately, the ones I was telling you to get, the analysis and stuff like that, those tend to be more expensive. But sometimes in certain places, if you get it from a state licensed dispensary, it might be less, but it just depends on your state and dispensary. But in general, it's definitely not reimbursable. The one exception is I told you there's this one drug called Epidiolex, which is a form of cannabis you could use for this rare seizure disorder that, would be reimbursable. And there's some cannabis related compounds you can use for severe nausea, and that would be reimbursable. But those are, prescription drugs. If you're just going to the dispensary and picking some up, that wouldn't be reimbursed. You'd be paying out of pocket.
Yeah. So you're on your own with this, and you need to make sure that you pick good quality product that are verified independently by analysis lab. So I wouldn't go for the cheap one either. right?
Right. If you're a professional athlete, this is not something I would cut corners on, because who knows what's in it, if you're just getting the cheap stuff.
Super. All right. Well, I think that's it, Greg. Thank you so much for your wisdom on all of this. That was really interesting, very educational. I personally learned a lot, and I'm sure other athletes will learn a lot. We are very uneducated in that space. And with what happened recently before at the track and field Olympic trial, I think we all want to learn a bit more and understand how to use it if we want to use it, and what's the system and framework to do that correctly. So really appreciate that you took 1 hour out of your trip to sit down with us and do that. That was really interesting. Thank you so much.
Well, thank you. Thanks for having me. I had a great time.
Super. Thank you, Greg. All
Thanks,
right.
Miriam.